Dr. Diez, let's talk about dentures. Lots of people, I mean, you have talked about, denture is one way of replacing teeth in all kinds of ways, and they must be replaced. But there are lots of people out there, they have dentures for a while, and they then come in and say the dentures are starting to shift and not fit well and get wiggle wobbly. And they think something is wrong with the denture when that's really not the case. Shed some light on us, tell us also, and tell us how they can be these days repaired, replaced, what is all out there to make denture better than they were before.
All right. Well, first off, when dentures get loose, it's usually because of a change in the body. As we get older, the bone in our jaws resorbs or goes away. It gets smaller. As it gets smaller, the denture doesn't fit as well.
That especially happens. Let me interrupt. That especially happens with the gums and the jawbones when the teeth, which people who have dentures obviously have no teeth. So when when the root of the tooth is out of the bone somehow thinks I'm useless, and it starts shrinking exceptionally fast compared to the rest of the body.
You're exactly right. Yeah. The only purpose of the gum and the bone in our jaw is to hold the teeth in. So what you said is exactly right. When the teeth are gone, it's lost its purpose. So the body sees it as that, and the bone eventually it gradually resorbs or goes away, dissolves.
Okay. And that's where this caved-in, dried-out tomato, looking like a very old person. That's what we associate an old person with. It becomes a very cosmetic, not looking good thing. So basically, right?
That is correct. But a denture can fill in the natural contours of the face. Mm-hmm. So it doesn't mean the bone stops shrinking, because it will keep shrinking, but the denture can fill in the natural contours of the face.
So you're patting it from the outside with the denture, basically. As long as the denture is in the mouth, then it pats it from the outside, almost like a Botox kind of thing.
Yep, that's exactly right.
Okay.
But what we were talking about when the denture gets loose is, again, that bone is shrinking. A lot of times the denture can be we call relined, or you fill the denture in, it fills in the void of the bone shrinking. And as long as the denture was in decent shape, the denture can be made to fit just as well as it did, the first day the patient received it. So that's one of the ways to tighten the denture. A lot of times the denture just gets worn. A lot of times we see them where they're cracked or chipped, and really the denture has to be totally intact to get proper suction and stay in the mouth. Older dentures, a lot of times, they have to be remade and reshaped to fit the patient. So a new denture is definitely a very common procedure to correct poor fitting previous dentures. And then we've talked about it before. There's also implants where they put an artificial root, or basically a titanium post up in the bone, and it simulates the root of a tooth. You can put anchors or snaps on these implants or artificial roots, and the denture actually snaps into it. So it actually locks into place, and it makes for a very secure fitting denture.
So basically, we have kind of a hybrid. You have how many implants? 2, 3? What are we talking about?
It depends on the top. 4 is a nice number. You get the 4-corner effect. On the bottom, again, if you can get 4, but there's some very, very nice dentures secured by implants with only 2 implants in place. And sometimes they'll join the implants with a bar, and the denture snaps onto that. And again, it makes for a very, very secure fitting denture.
Well, let's talk secure fitting denture. Let's put that in our layman's language. So what are the advantages for the patients there? Can he now test his food better? Does the denture now, is it not subject to get wiggle wobbly and loose ever anymore? What are we talking about here?
The most common complaints that you hear from patients is, I'm sitting talking to my friend across the lunch table, and I'm trying to chew, and my denture comes out, and it's so embarrassing. Or the denture will fall out when the patient is talking. Normal speech, it will fall out. Those are the two most common problems. Picture trying to have a conversation with someone and with the fear that your teeth are going to fall out, or trying to have a luncheon with someone and you fear that your teeth are going to come out of your head. It's not a good feeling. It's not a very secure feeling. So having a tight-fitting denture, a denture that you feel very confident will stay in, is very, very important for self-esteem.
Okay. So in this HyperEdge, being hooked to an implant, does that?
Oh yeah.
And yes, is it longer lasting? Is it longer lasting than in terms of not getting shifting than a normal denture, which doesn't have these implants?
Right, and we can go back to what we talked about before. When you put the implant in place, then you have given a reason for the gum and the bone to be there. So the bone that the denture is sitting on has a purpose again, and it will not dissolve or resorb like we talked about.
Even though there's only 2 or 4.
I'm sorry.
Even though there's only 2 or 4 of those implants in it.
That's right. Well, in those areas. But because the denture fits so much more secure, you usually have less resorption or dissolving of bone in the other areas.
What about biting? Biting into an apple, is that kind of like better too with the implant denture than with the normal dentures?
It is going to be much more like having natural teeth, right, if you have a denture that is secured by implants. The patients will be much more confident in eating foods such as corn on the cob, apples, food that's hard to chew, including sticky food, and much more confidence with implant dentures.
Absolutely wonderful. And probably there's then, a lot less, rubbing and stuff going on in the mouth, right. and all that must be comfortable not to have, right?
That's right. If the denture is secured by implants, like you talked about earlier, it's not going to be wiggly woggly. When the denture is sliding around is when it causes chafing and sore spots. So the more stable the denture is, the less likely the patient's going to get sore spots.
Okay. Well, all right. That's wonderful. So basically, with a couple of implants, maybe 3 or 4, whatever, but with instead of like putting 15 or 20 implants or whatever it might be, or what a person needs, which is definitely more expensive, beautiful, gorgeous, everything, one can go still with a denture, with a couple of implants in it. So price goes up a little bit, but the effect are almost close to having your normal teeth or full implants again.
That is correct. That is absolutely correct.
That must be good news for the about 30-some million people who wear dentures out there in this country I'm talking about.
It's excellent news. What surprises me is a lot of people don't know about it.
Well, maybe your dentist should tell them.
I think you're exactly right.
Well, all right. Thank you very much. It's good to hear, good news in a field where all of us, it's from the old days. We're afraid. I mean, I remember having gone to the dentist when I was a kid, and one time my father slapped me there. That's not the only time he slapped me, but the dentist took his mirror, and, it's a kind of a steel handle in the back, right? I don't know whether they still have that, but anyway, back then it was a steel handle, and he turned it around, and he poked every tooth. And the one where I went, he said, that's the tooth we're going to have to pull. I don't think you guys do examines that way anymore. Do you know what I mean?
No, we try not to.
So that shows how old I am. But and by the way, I disagreed with the dentist, who also was my physician. Was physician dentist, did everything. Small town in Austria, 2,000 people. And my father kind of like educating me that I shall not disrespect your doctor. He just gave
your dad was right.
He just gave me one with his backhand. And the tooth started hurting 2 days again. He pulled the wrong tooth. And my father did excuse himself. But in any case, it's nice to see that, that really things are nicely happening there. It's not painful anymore, and it can be done.
No, it's not.
Aesthetically, it's nice, and even functionally, it's nice. Thank you very much, Dr. Diez.
Thank you, Helmut. Nice talking to you.